Hey guys, this is Dr. Morgan Camp, MD. I just want to talk a little bit about low dose immunotherapy today, give you a brief introduction into it and how it works, and a few brief guidelines. Again, low dose immunotherapy or LDI. This is a treatment that has been around, used in the US for over 40 years or so now. It was brought into the US by Dr. Butch Schrader, from whom which I learned. It's been popularized by Dr. Ty Vincent. I worked with Dr. Vincent closely many years ago to help some of his formulations, and I've used it myself for at least a decade now, and have had great experiences using it personally and with many patients. LDI is a treatment, again, been used in the US. It's been used under a special use authorization from the FDA. It's not FDA approved. Just want to put that from the beginning, but it's a very safe, very effective treatment that's been used probably by more than 100,000 or so patients. I have never had a patient with a serious side effect to it. Nothing that's lasted more than a few days, and I'll talk more about side effects in a few minutes. So what is LDI, or low dose immunotherapy? Low dose immunotherapy consists of a naturally occurring molecule that occurs in our body that each human has, called beta-glucuronidase. That beta-glucuronidase, when combined with an antigen, meaning the part of a bacteria or virus or yeast that stimulates our immune system, you put those two together, and our immune system basically takes the beta-glucuronidase with that antigen, and it stimulates our immune system in a certain way to better recognize that antigen as foreign. And what that does is that does two things. That one, therefore, lowers the inflammation and reactivity that our immune system has chronically had to that antigen, and it also increases our immune surveillance of that antigen. So I know that's a lot of big words. So let me go over a couple like little use scenarios. So classically, LDI was used by Dr. Schrader for rheumatoid arthritis. So in certain patients with rheumatoid arthritis, it's been known that people had a certain infection with either a bacteria Proteus or Klebsiella, and then after that infection was cleared, they would get symptoms that looked like rheumatoid arthritis. So Dr. Schrader and his mentor and other doctors used this antigen with Klebsiella and Proteus combined with the beta-glucuronidase to basically treat people with rheumatoid arthritis and lower their symptoms of pain and inflammation. And it worked really well in some portion of patients with rheumatoid arthritis. What other uses does LDI have, and what else has it been used for? I've seen the greatest success for patients with Lyme disease, rheumatoid arthritis again, Epstein Barr virus and chronic fatigue, as well as for long COVID. What are the benefits of LDI? So big benefits are, it's again lowering that inflammation that is stimulated by the infection. And so that varies from person to person. So depends on what your symptoms of it, what the symptoms of inflammation are that it's calming down. But the most common ones are pain, brain fog, fatigue. Yeah, those are the main ones. How quickly can one see the benefits of low dose immunotherapy? I gave one to a patient a few weeks ago. He noticed benefits the next day. He had increased focus, concentration, and energy within 1 day of his first treatment. That sometimes happens. Some patients require 2 to 3 months of therapy to get that level of benefit. What is certain is most people need to do the following. Most people need to take the low dose immunotherapy and then note what symptoms get better, what symptoms get worse, and what didn't change, and give that back to their practitioner, that information. Why do I say that? Because low dose immunotherapy is very dependent on the dose. The dose has to be finely tuned up or down. And if you give too high of a dose, you will get a flare-up of symptoms. And if you give too low of a dose, you'll get no benefit at all. So when you get the dose perfect, you'll get an improvement of those inflammatory symptoms that will disappear for anywhere from 2 to 8 weeks or potentially longer. I'll talk more about that in a minute. What are the side effects of low-dose immunotherapy? The side effects are dose-related. So like I just mentioned, if the practitioner gives too high of a dose of low-dose immunotherapy, you can get a flare-up of whatever symptom is in your body. So that might be pain, fatigue, brain fog. Those are the most common ones. And if that happens, it doesn't mean you have a permanent side effect. It usually lasts just a couple of days, and then it goes away. And it's very important, of course, you tell your practitioner this, exactly the symptoms that got worse, so that the next time you're treated, the practitioner will bring your dose way down to avoid that, okay? Again, that only happens maybe 5% of the time. But if it does, it doesn't mean LDI is not for you. It just means the dose is likely too high. How often should one take LDI? Typically, dosing is every 8 weeks. However, at the beginning of therapy, you might need dosing every 2 to 4 weeks, or as your doctor or practitioner is learning to get the dose correct for you, there might be some adjustment time needed to help you get the right dose dialed in. So for example, if your practitioner gives you a dose of LDI and you notice a huge improvement of blank symptom or blank symptom for 2 weeks, it's imperative you let your doctor know what symptoms got better and for how long they persisted before they came back down to where they were before, because then your physician practitioner can change the dosing so that next time perhaps it lasts a little longer. The goal is that your low-dose immunotherapy should benefit you at least 2 months or so and potentially longer. It's very common that the first dose of LDI lasts a few weeks. The second dose, perhaps a few weeks longer. So perhaps 2 to 4 weeks for the first dose, 4 to 6 weeks for the second dose, 6 to 8 weeks for the third dose. Again, that's general guidelines, but that's typically what we see. Then after a year or two of taking the low-dose immunotherapy, it's likely that maybe at that point, maybe you only need 1 or 2 doses per year because it's lasting for up to 6 to 12 months at a time. Another question I get is, what happens if I stop the LDI after taking it for a period of time? There's no downside. There's no harm to your immune system doing that. And hopefully you'll still have some of the benefits of taking it for a while. It might be perhaps that after you haven't taken it for of 6 to 12 months that some of the symptoms might recur, but that's an easy solution. You just reach back out to your practitioner and get another dose. So it's critical when you're taking LDI to track your symptoms, 1. 2, communicate clearly with your practitioner or physician what symptoms got better, what symptoms got worse. And 3rd, how long did the symptoms get better or worse for? If you communicate that clearly to your practitioner, they can adjust the dosing so the LDI is working better for you in the future. Thank you so much. I hope this answered your questions about low-dose immunotherapy. If you have any further questions about this, please reach out to my staff. Again, Dr. Morgan Camp, MD, thank you. Have a good day.